I'm Jemy Jose. I'm one of the ear, nose and throat and head and neck consultants at Hull and East Yorkshire hospitals. I'm part of the team of head and neck cancer specialists in this hospital, and we cover the region including Hull, East Riding, Bridlington and Scarborough on the North Bank, Grimsby and Scunthorpe in the South Bank, and all the regions of North Lincolnshire and North East Lincolnshire. Throat cancer, and particularly laryngeal cancer, voice box cancer, is an extremely serious condition for a number of reasons. The average 5-year survival rate, or the chances of a person with voice box cancer surviving for 5 years is around 50% at an average. Secondly, the area of the voice box and the throat and the head and neck area is the area with which a person faces the world on a day-to-day basis. We take our ability to speak, the ability to enjoy a meal, eat and drink, and our appearance for granted. If you can imagine a world where you are not able to speak at all, or speak in a different way, or not able to enjoy a meal or swallow normally, or in fact have a big scar, or having a disfigurement, only then one realizes the importance of that region. Needless to say, the earlier we catch it, the better will be the final outcome. For these reasons, throat cancer needs to be tackled earlier than later. The earliest symptom of voice box cancer or laryngeal cancer is hoarseness, or a persistent husky voice. Normally, following a sore throat, one expects the voice to get better after a period of 3 weeks and then return back to normal. So if anyone has a persistent hoarseness beyond 3 weeks, and particularly if it is not improving or indeed getting worse, that is a warning sign, or at least it's a sign that one should check out that everything is okay. One could also have a bad sore throat or pain in the throat, and difficulty swallowing. One could also have a physical lump itself, which one feels when feeling the neck, and unexplained weight loss. These are usually the symptoms or warning signs of a throat cancer or a voice box cancer. There is a team of specialists who treat these cancers, and that would involve the surgeons, the oncologists who deal with chemotherapy and radiotherapy. The treatment depends upon the stage of the cancer. So it could be by just one modality of treatment, or a combination of numerous modalities depending upon how advanced stage is. For example, the earliest of voice box cancer is nowadays treated with laser resection of the cancer through the mouth, and it usually involves just one night in the hospital, and that effectively completes the treatment, as opposed to a more advanced form of cancer which might require 8 weeks of radiotherapy, some chemotherapy added to that, and even some surgery, which means the treatment can go on for a period of 3 to 6 months at a time. So needless to say, earlier the cancer is caught, the better will be the outcome and less will be the treatment. It is very important that they contact their GP in the first instance if any of the warning signs that I mentioned do happen to themselves or their near ones. On this front, I have to particularly emphasize the role of their carers or the partners, wives, husbands, or even colleagues or friends. We have noted that it's often someone else who might bring this to your attention, and you must certainly listen to them and approach your GP as soon as you can.
My name is Bill Goodhand. I've been retired now for several years. Through a lifelong of smoking, I developed COPD. Because of COPD, you are prescribed several inhalers, and one of these is budesonide, and one of the side effects of that, it gives you a hoarse voice. fine, I've got a hoarse voice. It's through this smoking and this budesonide. Anyway, I got worried about this. I went to see the chemist in the village. Oh, he says, I know what that is. He says, it's that budesonide. Anyway, one weekend I was in the greenhouse. My son came over and was in conversation. And he said, what's the matter with your voice, Dad? So I went through what I've just told you. Anyway, to cut a long story short, I finished up at the GP. Then they sent me for a biopsy. And the result of the biopsy was, it was cancer of the vocal cords. When I saw the oncologist, he had been through the scans and all the rest of it, and he said, what I suggest, he said, you have 30 radiotherapies, and I think it was 8 chemotherapies. Well, it was awful telling the family that I'd been diagnosed with throat cancer, but if they were overwhelmed with the shock of that news, they obviously didn't show it, I believe, for my feelings. I understand men in particular have got a habit of putting things off like that, but I'm jolly glad I went to the GP. Because, as you know, cancer, once it starts growing, it just keeps growing. It doesn't stop and have a rest. What frightens me and worries me the most, if there's any smokers out there, and the voice starts to break up, and they do not go to the GP. I can only repeat the position I would have been in now if I'd have never been to the GP.
Hi, my name's Bert Dockerty. I'm 75 years of age. I got throat cancer 6 years ago, and I'm still in remission from throat cancer. I started with a tickle in the throat. Thought nothing of it. Carried on for several weeks. Then it turned to frog in the throat. And I kept losing my voice. Obviously I knew there was something wrong then. And I thought it was my chest actually. And I went to my doctor, told him my symptoms, and he said, I'll just have a quick look, examine my chest. He said, it's not your chest, and I'd like you to see a consultant with your throat. I'm a bit quirky about anybody looking down my throat, and they couldn't get a really good look, so they decided to take me to a Royal and put the camera down through my nose, because I couldn't stand it through my throat. They did see there was something wrong, and they asked if I could do a biopsy, which I did. I had a full medical the next day. They did a biopsy the next week, and the results from that biopsy, of course, there was cancer on my throat. Obviously my wife was very upset, both my sons were, but after I'd told them, when they said to me, well, don't worry, we've caught it in time, which they told me at the hospital, we'd caught it in time, they then sat back and thought, well, okay, that's not so bad. But they're still wary, you know. People think, well, cancer, it's a dirty word. It's not curable. But it is. 99 times out of 100 it is, if it's caught in time. And if you use your love and go and see your doctor, it'll get cured. No doubt about it. I'm living proof of that. This is one of the reasons why I wanted to make this film. To try and make men more aware of the fact that, don't sit there and think, oh, it's this or it's that, and it'll go away. It'll go away later on. It's just one of those things. Don't sit there and do that. Go and see your doctor. Get it looked at.